Hello everyone, and welcome back to the Institute of Mobility Masters and to our newly finished treatment area of the studio. In today's video, I will introduce a few self-treatment tools every mobility master should have. Over the years, I have moved away from using my hands and instead have developed my own system for addressing all major injuries using tools. Years ago, when I started treating patients, I used my hands exclusively to release trigger points. I quickly found out that as strong as my hands were, they were incapable of handling the physical demand the mountain man method required to achieve the kind of outcomes I knew were possible. As a result, early on I developed several hand injuries, struggled to heal more extensive, deeper injuries, and experienced longer rehab times. I now look at it like trying to build a house using a hammer instead of a nail gun. Once we have learned how to use a nail gun, we are never going to switch back, as the results are flat out superior. The Mountain Man method was also designed around the realization that with the proper tools and taking advantage of leverage, a smaller or weaker individual is able to target and fix the deepest of injuries just as easily as a bigger and stronger person. Getting to this point took about 6 years of trying as many tools as I could get my hands on, until I found the most effective techniques and the simplest tools for the job. Over the course of our series, we are going to review optimal tools and ways of treating all major areas of the body, and you will get to see firsthand just how simple most injuries are to fix. Learning to use the tools is similar to learning to play an instrument, as we must develop a strong foundation in order to set ourselves up for long-term growth. Mastering the tools takes practice, but most injuries become easy and intuitive to address once the fundamentals of the Mountain Man method and the treatments for the tools have been mastered. Let's start by doing a quick overview of the primary tools that I use to fix 90+% of all injuries on myself and patients. By far the most important tool I use at my clinic is called the Body Back Buddy. I'd like to share a quick story about the company and their commitment to quality. To date, there are 3 versions of this tool that have been released. Following the creation of the second version, I contacted the CEO of the company as the tool that I had used for years had become too flexible and struggled to efficiently treat the deeper injuries, especially during self-treatment. After bringing this to the CEO's attention and extensive testing on their end to confirm the issues, they immediately set out to create a better version. They changed to a more rigid and durable material, capable of going even deeper than the original, created contoured handle holds making it easier to grip, and added numbers making it much easier to teach the techniques. The end result is the best version to date. This was an incredibly time-consuming and expensive process that really showed me where the company's priorities are. While I currently don't have any financial ties to this company, it is my goal in the near future to team up, make an extended treatment manual, and promote the tool, as it is the most versatile and important tool I have come across, not just for self-treatment, but also for treating patients. I'll give you a quick demo on the Back Buddy. If we start in the upper neck, we're able to treat conditions such as headaches, numbness, dry eyes, whiplash, chronic pain, weakness, and dozens of other functional limiting symptoms. The symptoms and referral patterns each trigger point causes have been well documented, so once a person learns how to use the tools along with the Mountain Man method, most injuries become easy to fix. So starting in the upper neck, the trigger points most commonly will cause decreased rotation of the neck and also headaches. It is extremely rare that a patient comes in with a headache that's not related to the cervical spine and the muscles surrounding it. And they're very simple to fix for the most part. With the tool, I'm able to target the suboccipitals here, and I get good leverage, and usually just releasing along this line will take care of headaches, and if you strengthen the area too, it's a permanent fix for most patients. For the lower neck here, I'll usually target just like this. Pec minor. This is a trigger point that makes upright posture uncomfortable, and that's why a lot of people will avoid it. Simply by releasing the pec minor trigger point, I can allow my shoulder to drift back into the position it's meant to be. I can target it very easily just like that. The abdominal region. These trigger points are very interesting because they have an effect on the organ. So with the trigger points in this area, patients will often come in with issues like acid reflux, constipation, and even secondary bladder dysfunction. I'm able to target that very easily, just like this, so we would identify the trigger point causing the problem by pushing on it, recreating some of the symptoms, and then we know we have the correct one and we can go into the process of releasing it. Hip flexor is very common in runners, especially sprinters, area that requires some maintenance, and what you'll see is they have a slowed reaction of getting their knees up, so as they get older and further into their career they actually get a little bit slower. This is an area that just requires some maintenance, very simple to get. For 90+% of all patients who come in with knee pain, it's almost never the knee that's the actual problem. If you look at the vastus lateralis, there are trigger points that form right under the IT band here. And these are the #1 cause for pain all around the front of the knee and even under the kneecap. Very simple to fix. I have a couple different positions I can hold from, just like this. I'm also able to target and pull it towards me if I need to. When I push here on a patient who has knee pain, it's usually going to increase their symptoms, again letting me know that I have the right area. For a patient that came in, tore a meniscus, and it showed up on imaging, but they're trying to avoid surgery, most of the time there'll be a trigger point that forms here too. And when you release it, the pain on the inside and into the meniscus goes away. In that event, as long as they have normal movement, which most do, we're able to avoid surgery, and the pain that they were feeling was never caused by the meniscus, even though the meniscus has a slight defect at that point. For patients who hold their ankles many times, there are trigger points on 2 muscles here that evert the ankle just like this. And when you roll the ankle, they get injured and those muscles become weak, leading to lifelong ankle rollers. Very simple to fix, again, even if you've torn some ligaments in the ankle. And this is very easy to get, just like this. Again, I'm just kind of holding and leaning my body weight back, making it very simple to get this whole area. Patients with heel pain, very common. You see this a lot with runners, people who jump a lot. Most of the time it has nothing to do with the heel. And the referral pattern for trigger points in this area is into the heel or into the Achilles tendon. Very simple again to treat. I could start up here. There are 3 main trigger points that tend to cause that in the calf region. We have one here, here, and here. Moving on to the shoulder. I like to target this up against the wall because I can use my body weight to do all the work, and it's easy to target all areas of it. For the front of the shoulder, we have one of our 4 rotator cuff muscles, subscapularis. This one very frequently will refer pain into the actual armpit. And to target it, I'm just going to put pressure like this. I'm leaning my body weight, and my body weight is doing all the work. So my muscles are pretty relaxed as I'm doing this. Anterior deltoid, very common area to get injured. The pain's usually pretty localized. And again, I'm just going to use my body weight. I'm leaning into it, and I can release it just like that. Lateral deltoid. Again, localized pain, very common area to get injured, and you will see elevation becomes very difficult or painful. And that's a localized pain too. We usually have 2 to 3 trigger points, one at the insertion point right here, and then there'll be also right below the bone here, we'll find 1 or 2 other ones that we want to release if they're present. Back of the shoulder, we have our infraspinatus, which is again one of the other 4 rotator cuff muscles. This one will actually send pain all the way down to the thumb and maybe even numbness. And so we got to make sure the pain's not being referred from up here if we think we have a thumb issue. Very simple to get. Just below that, we have our teres minor, which will be localized pain, and it actually will go right into the tricep here. The muscle below that is our teres major. This is a very important muscle because it tricks a lot of practitioners into making false diagnosis. And this muscle has the ability to refer pain into the joint. And so say a patient comes in and they got imaging, they tore their labrum, and they decide, you know what, I'm going to get surgery to repair that. They get the surgery and they haven't improved. It's because the problem was never the labrum to begin with, that all they had to do was release that muscle. And now they have 2 problems. They did a surgery they didn't need, and the original problem's still there. The way to avoid this is you just check to see if that trigger point's there, you release it. In most cases, even if there's a labrum tear, the pain's going to resolve and you're going to get normal function back. In some rare cases, we'll have to go for surgery, but very small amount of people. Supraspinatus, another one of the 4 rotator cuff muscles. One is targeted like this, and it's right below the upper trap. This muscle right here is localized pain, and we also can get elbow pain. So somebody might think they have tennis elbow, very common term that we'll hear, and they'll have a lot of pain here, but there's nothing going on there. They can't find anything, they're getting injections, and it's just not working. And it's because the problem was never here, it's actually being referred from the supraspinatus. Easy way to tell if this is the culprit is we'll usually have pain here, kind of a dull pain here, and then more localized pain here. So we can use these referral patterns and they start to make sense. Next we have a lacrosse ball. This is the best tool I found to fix the back of the hips, the side of the hip, and the low back. Very simple, and the reason for that is these are very thick muscles and we got to get in quite deep. And this, I'm using my body weight, and again, I'm lying on it and it's doing all the work for me. If I'm very sensitive and I can't tolerate as much pressure as I need, I can put a yoga mat or a towel and put a couple layers. As my tolerance goes up and I want to get to the deeper muscles, have less and less layers until I'm on a hard surface like this. Again, very easy to get because we have the right tool for the job. For the glutes, interesting thing about the glute medius is I would say about 95% of all patients who come in who say they have back pain has nothing to do with their back. It's actually the glute medius. And we can prove it to them again. If we release it, either the pain changes or it doesn't. For this one, all I'm going to do, I could be kind of in a seated position like this, leaning back. There are usually 3 trigger points that form. One right here that refers pain into the middle of the back. We also have one that forms right about here. This one will potentially send down the back of the hamstring, would be its referral pattern. And on the side right here, this one will sometimes send pain all the way down the leg to the side of the foot. And the glute minimus can also do this, so we have to be aware that there are 2 muscles that tend to do that referral pattern. But very easy, again, using my body weight, so I'm not having to work hard. When I get to my low back, I'm gonna lie down like this. Because of the curve of the back, I'm gonna wanna use my knee as my lever. And this determines how deep I get into the low back muscles. So I'll put it here, and if I were to just try to treat like this, I'm only gonna get the upper superficial muscles. But this flattens my back out. So using this as a lever, I'm able to get very deep in there. Moving on to the foot, we're back to the back body. Couple little things. So just like the hand, all of our extensor muscles are here and in the shin area here. We have extensor digitorum brevis, extensor hallucis brevis. Those go to the more proximal knuckles here. And we have extensor hallucis longus, which goes out further. And we have extensor digitorum longus, which goes out further. If our pain is here in the closer knuckles, we're going to look at extensor digitorum brevis. And if it's further out here, we want to check out the extensor digitorum longus. So I say this because it comes very easy. The pain's here. What muscle attaches there? Extensor digitorum brevis. Okay, let's check. Is there a trigger point here? Yep, let's release it. Does our pain change? Yep, it did. We get confirmation we're on the right track. So these are all little puzzles, and I always tell patients most injuries are easy to fix if we get good at solving these puzzles, and we get confirmation right away whether our hypothesis is correct or not. On the arch, we have a couple muscles here. So we have our abductor hallucis muscle and our flexor hallucis muscle. These will usually cause arch pain. Very easy to target. I'm going to take the tool right here, and I'm going to go looking. I find the one that mimics my symptoms, and I'm going to use the weight of my leg, and I'm not actually pushing or anything. My body weight is doing all the work. I'll release that. If I'm correct, my arch pain should start decreasing, at which point I'll say, okay, we got to release the rest of it, and we got to strengthen it to build our armor, and then we're good to go. Moving on to the arms, forearms, and hands, we have two main tools I like to use: the deep tissue release tool and the jackknobber. Both are great in just a matter of preference, and I like the smaller tools because they're more efficient when you're working in these areas. Starting with the tricep, very easy to get. Again, I'm going to use my body weight, so I'm really not doing much work. Tricep is usually a localized pain in the armpit, or very commonly in the elbow, Lacrosse process, that pointed area here. And a lot of times when I'm treating it, I'll put deep pressure, looking for the trigger point, and when I hit it, the pain will actually go into the elbow and I'll know I have the right spot. So I'm pretty much posing like I am for a photo shoot, and I'm doing zero work. I'm just relaxing, sinking in, and I can treat that area very efficiently. Going to the forearm, we have all of our wrist extensors are going to the outside of the elbow and flexors to the inside of the elbow. Tennis elbow, golfer's elbow. Very simple to treat and diagnose, because if it's issues up here, it's usually going to be in the back of the hand on the fingers here. And if we have an issue over here, it's going to usually be on the palm side of the hand, or on the inside of the elbow or the outside of the elbow. Thing to realize about muscles in this region is the muscles frequently refer pain into the bone. So for instance, a lot of patients will come in and they'll have arthritis in the fingers, especially in the knuckles, and they're seeing it on imaging and they have pain and they've got on medication, it's just not working. And despite having these changes to the joint was never the problem, so those interventions aren't working. If we follow these tendons up to the muscle belly and we find a trigger point there, frequently we can push on this, we recreate the pain in the knuckles, we release this, and despite those joint changes, the pain goes away completely. Very common. Same with the inside of the elbow. If we're having pain over here around the fingers, this is pretty much all bone. So we're following those tendons up to the muscle belly and looking for the problem. And when we hit it, a lot of times we'll accentuate that discomfort, we release it, and despite those changes, we're good to go. The thumb, very, very important one. As we get older, and we're doing all these gripping activities, it gets injured, and even if we have no pain or symptoms that catch our attention, we're gonna get weaker. And as a physical therapist, it's an area that I just do a little maintenance on myself, and pretty much every patient who comes in who has hand issues, when I release that, their grip strength and their ability to open jars goes right up, because this will start to shut down the thumb, your ability to squeeze like this. We also have an issue called de Quervain syndrome, and there's a lot of pain in this area, very common for people who type a lot, people who sew. And the pain is here, and you can see these two tendons, but the problem's not there in the tendons. The problem is actually if we follow these up to the muscle belly, we'll likely find a muscle strain there. And we're talking about even after 2-3 minutes of releasing that, the pain over here will start to go down. We know on the right track. Release these trigger points. And it's almost never that I have a patient come in where the pain doesn't go away really quickly by addressing the actual muscle belly. So an important concept to start understanding is pain is usually referred in the forearms and also in our lower legs into the bone or the tendon, but the muscle's the problem, and we can prove that to ourselves by releasing it and seeing that change or not. The last tool I like to introduce is a high density foam roller. You can notice it's a smooth surface, nothing too special about it. I'm not using this to actually mobilize my muscles because it's an inferior intervention compared to the other tools. But for the job, this is the best tool for mobilizing the spine that I found. And I'm going to mobilize from my upper low back to the top of the shoulders. My goal is to prevent myself from becoming forward flexed as I get older, as I'm going to become a lot more prone to injuries throughout my entire body. A nice tool like this, I use it every day just for a minute or two. It feels really good. And my goal is to mobilize the spine so upright posture becomes my most preferred position there. If you've never done this before, the first time you do it's going to be pretty tender, and that's all right. You want to work through that, it might take you a few sessions. Pretty quickly that tenderness will go away. Once that happens, our goal, assuming we don't have osteoporosis or anything that could put us in danger, our goal is to add a weight in. and this is going to help us stretch the ligaments surrounding the joint capsule further. So I might start with a 10-pound weight and I'm going to work my way up. I personally will go to about a 30 or 40-pound weight now. It feels really good. If a person who's never done this were to do that, they're probably going to injure themselves. So we got to be incremental as we work our way up and we find our threshold. This helps me really stretch. I'll find a section that might feel real tight, and I'm going to sink my hips and my shoulders down. And by doing this, it gives me control of my spinal mobility. Again, if we think about our postures, we're always being pulled forward by gravity, working on the computer, reading a book. We got to counteract that. It's that time. We are at the end of our video. I hope this was a helpful introduction to the tools that we'll be using and gave a taste of what's to come. In the next video, it's time to get down to the fun stuff, as we'll go through the process of rehabbing our very first injury using the Mountain Man method. I attached links under the description section to all the primary tools I use. There are a lot of knockoff brands that look almost identical to the Body Back Buddy Elite, but function poorly, so be careful when purchasing tools. As always, if you have a friend or family member who you feel could benefit from a different perspective, please share a link and invite them to subscribe and click the bell to get notifications when new content arrives. If you feel inclined, please also leave a comment below, as it helps promote the videos higher up in the search results when people look for help rehabbing their injuries. Thank you again for tuning in, and we look forward to seeing you next time.